Metabolic Impairment Syndrome, MIS, and Cancer. MIS is a name that I have coined to cover various metabolic problems of the body of impaired use of carbohydrates, fats, and proteins. Although diabetes is considered to be elevated glucose levels, I feel that diabetes is really an impairment of metabolism of the three main food groups: fats, all carbohydrates, and proteins, and not just sugar. This is based on years of research and my treatment of diabetics. I have written a book on the subject, Find and Stop Diabetes. This book is looking at problems and solutions for pre-diabetes. I really look at this endocrine problem as a continuum of the disease state. There are different stages that can include low sugar levels, normal or elevated sugars, along with a process of impaired ability of the body to process and utilize the three major food groups. The importance of recognizing this syndrome is the following: find ways to diagnose, treat and prevent the progression to diabetes, cancer, heart disease, renal disease, vascular problems, Alzheimer's disease, neurodegenerative diseases, and other medical problems. A new book has been published by an endocrinologist that states that 97 million Americans have insulin resistance. 10 to 20 million Americans have diabetes and do not know it. This is because of no testing or limited tests. I have invented new novel ways to evaluate this. First, I want to explain more about this metabolic problem. Metabolic impairment syndrome is related to metabolic problems known as metabolic syndrome, syndrome X, cardiometabolic syndrome, insulin resistance syndrome, Revens syndrome, dysmetabolic syndrome, or prediabetes. Metabolic syndrome has typically been referred to as a group of conditions that includes increased blood pressure, a high blood sugar level, excess body fat around the waist, and abnormal cholesterol levels may occur together, increasing risk of heart disease, stroke and diabetes. Having just one of these conditions doesn't mean there is metabolic syndrome. However, any of these conditions increase, there is going to be a serious disease. If more than one of these conditions occur in combination, the risk is even greater. Having metabolic syndrome means there are disorders related to metabolism at the same time, including obesity, with your body fat concentrated around the waist. For a metabolic syndrome diagnosis, obesity is defined by having a waist circumference of 40 inches or more for men and 35 inches or more for women, although waist circumference cutoff points can vary by race. Increased blood pressure, meaning a systolic blood pressure measurement of 130 mm of mercury or more, or a diastolic blood pressure measurement of 85 mm Hg or more. High blood sugar level, with a fasting blood glucose test result of 100 mg per deciliter, or 5.6 millimoles per liter, or more. High cholesterol, with a level of the blood fat called triglycerides of 150 mg/dl or more, and a level of high-density lipoprotein cholesterol, which is the good cholesterol that is less than 40 mg/dl for men or less than 50 mg/dl for women. Obesity is defined as having an excessive amount of body fat. Obesity is more than just a cosmetic concern, though. It increases your risk of diseases and health problems such as heart disease, diabetes and high blood pressure. Even modest weight loss can improve or prevent the health problems associated with obesity. Weight loss using through dietary changes, increased physical activity, diet, stress reduction, and behavior changes can make a difference for health. According to the International Diabetes Federation, the number of people with known diabetes as of the year 2012 is 371 million. This is expected to reach over 550 million in just another 18 years. This is associated with cancer, and diabetes and cancer are major causes of death. inability to control carbohydrate intake and proper metabolism along with elevated blood pressure, diabetes and heart disease adds to the 3 biggest killers on the planet. Some of this may be due to the role of endocrine disrupting chemicals and the cause of metabolic problems. The idea behind this brings together an explanation of insulin resistance. In a study called Metabolic Syndrome and Postmenopausal Breast Cancer, Systematic Review and Meta-Analysis, this was published in Menopause, 2013 April 8 by Esposito K., Chiodini P., Capuano A., Bastella G., Maiorino M., Raffagnello C., Giugliano D. The role of metabolic syndrome and its individual components in postmenopausal breast cancer risk is still unclear. They reviewed and summarized epidemiological studies assessing the association of metabolic syndrome with the risk of breast cancer. There were 9 articles, all published in English, were included in the meta-analysis. Metabolic syndrome is associated with a moderately increased risk of breast cancer. No single component explains the risk conveyed by the full syndrome, but I believe it is due to the acidic toxic state of the cellular environment that contributes to the other risk factors for breast cancer. The journal Endocrine 2013 shows colorectal cancer association with metabolic syndrome and its components. A systematic review with meta-analysis by Esposito K. et al. They performed a systematic review and meta-analysis of the empirical evidence on the association of metabolic syndrome and its components with colorectal cancer incidence and mortality. A systematic literature search of multiple electronic databases was conducted and complemented by cross-referencing to identify studies published before the 31st of October 2012. Every included study was to report risk estimates with 95% confidence intervals for the association between metabolic syndrome and colorectal cancer. They identified 17 studies, which reported on 49 datasets with 11,462 cancer cases. Metabolic syndrome was associated with an increased risk of colorectal cancer incidence and mortality in both men and women. Metabolic syndrome is associated with an increased risk of colorectal cancer incidence and mortality in both sexes. There was a recent study of metabolic syndrome and risk of cancer, a systematic review and meta-analysis by Esposito K., Chiodini P., Colau A., Lenzi A., Giugliano D. In Diabetes Care. 2012 November 35 to 2402 They analyzed 116 datasets from 43 articles, including 38,940 cases of cancer. In studies in men, the presence of metabolic syndrome was associated with liver, colorectal, and bladder cancer. In women, the presence of metabolic syndrome was associated with endometrial, pancreatic, breast postmenopausal, rectal and colorectal cancers. Associations with metabolic syndrome were stronger in women than in men for pancreatic and rectal cancers. Metabolic syndrome is associated with increased risk of common cancers. For some cancers, the risk differs between sexes, populations, and definitions of metabolic syndrome. Obesity and physical inactivity are related to impaired physical health of breast cancer survivors according to a study in Anti-Cancer 2013 April, 33 to 1595 602, by Elmer, et al. The aim of this study was to examine the impact of obesity and physical activity on the health and well-being of patients with breast cancer shortly after the adjuvant treatments. A total of 537 women aged 35 to 68 years with newly diagnosed breast cancer were enrolled into the exercise intervention study. The physical activity, physical performance, cardiovascular risk factors, quality of life, comorbidities and body mass index were measured after the adjuvant treatments. Overall, 191 patients were overweight and 85 obese. Physical activity and performance, cholesterol and cholesterol decreased. Hypertension and metabolic syndrome, glucose and insulin levels increased linearly with BMI, higher waist circumference, triglyceride, insulin, rate of metabolic syndrome, and lower HDL cholesterol and cholesterol were associated with low physical activity. Physical activity and BMI were the most important determinants of physical performance. Obesity and a sedentary lifestyle are related to poor physical performance, increased risk of cardiovascular diseases and impaired cholesterol, leading to a vicious circle, which impairs patients' physical health and cholesterol. Is there any association between insulin resistance and thyroid cancer? A case control study in Endocrine, 2013 by Balkan F. et al. They describe the role of insulin. Insulin stimulates proliferation of thyroid cells in culture. The presence of insulin resistance is associated with larger thyroid gland volume and an increased prevalence of thyroid nodules. Neither metabolic syndrome nor IA was a significant risk factor for thyroid cancer. Some other pathologic mechanisms may be more prominent during thyroid carcinogenesis. Metabolic syndrome and its components are associated with increased thyroid volume and nodule prevalence in a mild to moderate iodine deficient area according to a study in Urge Endocrinol, 2009 October 161 to 599 605 by A. Turkes, et al. I have read other studies that relate an increase of breast cancer of 300% in those on thyroid hormone replacement for more than 10 years. Metabolic syndrome is a cluster of metabolic abnormalities with insulin resistance as a major component. It has been recently questioned whether metabolic syndrome and its related components are associated with functional and morphological alterations of the thyroid gland. The aim of our study is to examine thyroid volume and nodule prevalence in a case control study of patients with metabolic syndrome in a mild to moderate iodine deficient area. 278 patients with metabolic syndrome were randomly matched for age, gender, and smoking habits with 261 subjects without metabolic syndrome, serum TSH, free triiodothyronine and thyroxine, and the level of IA, which was estimated by the homeostasis model assessment for insulin resistance, as well as other metabolic syndrome parameters were evaluated. TSH was significantly positively correlated with the presence of metabolic syndrome diagnosis. These results suggest that patients with metabolic syndrome have significantly increased thyroid volume and nodule prevalence. Their data provide the first evidence that insulin resistance is an independent risk factor for nodule formation in an iodine-deficient environment. There is another study of metabolic syndrome in non-diabetic, obese, first-degree relatives of African American patients with type 2 diabetes, African American triglycerides HDL-C and insulin resistance paradox in a study published in ethndis. 2006 Autumn 16 to 836 by Mays S.B., Schuster D., Gaillard T., Ozai K. They discuss the role of metabolic syndrome and heart disease. Metabolic syndrome defines cardiovascular disease risks.